you could see was a jumble of meaningless words. There are thousands of people who are unable to read and write properly due to dyslexia. It's not only hard for them to learn at school, but to handle a job later on in life. Well, an American woman has unscrambled some of the problems dyslexic people have. She's best known here for a 60-minute story back in 1985 called Rose-Coloured Glasses. It showed the world for the first time how coloured spectacles could cure visual dyslexia. Would you please welcome back Professor Helen Irwin. Now, I think we sort of need to partly define dyslexia a little, don't we? It's such a broad term. I mean, I guess it applies to people who have reading difficulties, is that right?
Typically applies to people who have all different kinds of reading difficulties, whether it's due to neurological or memory, or they just can't read the words or they can't sound out the words. We're particularly dealing with a type of dyslexia that's perceptual, so that they may be able to sound out words, they may even be able to read the words, but they can't utilize their reading skills because things are changing on the page.
Okay, so the people you're dealing with have what you have called, or what is known as, scotopic sensitivity.
Right, and people are saying it's a type or a form of perceptual type of reading or writing or even studying type of problems.
Okay, so what are they seeing? When they look at a page, what are they seeing? And I think we can help people at home get some idea by showing here.
There's many different things that can happen and occur as someone reads, such as things can be swirling or moving or flickering, or the words get blurry on the page, or the white takes over, or they're bothered because it's so bright it's hard to focus on the page. You're seeing here things flickering on the page, you're seeing it going out of focus, and those are just some of the examples of what can be happening for the type of person that we can help.
So what you stumbled on is the fact that some light, some colours of light, irritates people more than others. Is that it?
Yeah, and there are certain circumstances, such in school, where you have fluorescent lighting, where it makes it a lot more difficult, and it happens. People may be aware of the fact that reading black print on high-gloss white paper, such as textbooks, is a lot more difficult than reading a novel where the paper is in high-gloss or white. More crowded print, smaller print, those factors all make this type of problem a lot worse.
Okay, you've brought in some glasses and some tinted lenses here. What do they do?
Okay, we're talking about the fact, and I'll show just some of the different colors here, and I want people to understand this is perception, not vision. Although they're seeing glasses, we're dealing with the fact that it's the brain that is inaccurately processing the information. And that's research that we've been doing in collaboration with Harvard Medical School and the University of New Mexico Medical School, that is actually showing now that when you use these very specific colors for an individual, and you know how to accurately diagnose, you can make it so the brain can now take in this information accurately.
So you're cutting out the bad light, letting in the good light?
Absolutely.
All right, now we have a tape of quite remarkable results that you saw with a girl called Katie. Let's have a look at that.
Everything is ready. Twist. I can't read that.
Go ahead and put your glasses back on. You look miserable.
Real witches dress up in ordinary clothes and look very much like ordinary women. They live in ordinary houses and they work in ordinary jobs.
That is remarkable,
Isn't that? Kate's 12 years of age, and people thought that she was just lazy or a poor student. She had tantrums when she had to do her homework, and now she's getting A's.
They are fantastic results. I suppose we should point out, and you'd want to point out, wouldn't you, that you can't help all people.
Only about 46%, or half of those individuals who find that they're having trouble reading or studying, can be helped by this process.
All right, now we have another of your patients, I think, from California, Christina. Let's have a look at Christina here, and you can maybe talk us through. Christina is 17, I believe?
Christina is 17 years of age, and people felt she was mentally retarded with an IQ of 61. Instead of teaching her any longer, starting last year, they had her washing dishes. Here you're seeing her copy. her name. And if you look at it closely, on top, she, without her filters, writes everything backwards. And on the bottom is her name, Christina, written with her glasses. So people couldn't figure out what she was doing because she wrote and copied things backwards.
It was
here,
gobbledygook, wasn't it?
Totally. Here, she's just writing the alphabet. And if you notice on top, she was supposed to be writing it A, B, C, D. None of the letters are right on top. Her writing is big and irregular. On the bottom, with her filters, it's correct and it's small. Okay?
And it looks like coherent writing.
And it's saying that it's affecting more than reading. Christina shows us that it affects math, keeping numbers in columns. She flipped all her numbers, copying. More, so we're dealing with a lot more than just reading.
Okay, now we need to go back to that because the final part of that tape is where Christina writes a sentence, and it's the most extraordinary contrast between what she wrote here before she put her glasses on and what she was trying to write on the bottom.
Yeah, and that's what she was trying to write, and with her glasses she was able to write, "I love you, Mom."
Fantastic. Do you understand exactly why these glasses work?
I'm not sure I personally understand it, but it's now with the help of so many different research projects, and it's the help of esteemed institutes like the Medical Research Council in England and Harvard Medical School and medical schools in Albuquerque, New Mexico, that were able to actually monitor the changes in the brain and how much more efficiently and effectively the brain can operate with just these color. And it has to be the exactly right color or it doesn't work.
Because that was one of the problems that you encountered when you first started to offer your therapy, your solution. There were a lot of people who said it was quackery.
Oh, yes, because we didn't know why it worked, and there wasn't enough research. And since that time, we've had tremendous change in government support, education support, literacy support. When I first introduced it in '85, I was the only one doing research. Now there's well over 155 research papers, of which 80% or more are showing absolute positive changes. We're getting government support where states are giving money to the schools in the United States so that the schools can make this part of their regular process. So it's not just capricious whether a child's going to find us and be able to get help or not.
Okay, so now it's not, we should also say it is not just dyslexic people that you can help, it's people who have other problems, I suppose visual related problems, spatial perception, I mean people who reach for the ball and it's 2 feet away than they think it was, who parking the car.
Yeah, difficulty parking and driving, difficulty in terms of negotiating in their environment, that they're having difficulty perceiving things the way they should be. And we're learning more and more about how perception, again, separated from vision. Vision is what, when you have a problem, you go to your optometrist. It's not vision, it's perception. And therefore, you need to go to specialists. But we're talking about some very severe cases also of where the perception in the environment is so distorted that these people have not been even able to function adequately.
Okay, now that brings us to another of your patients, Donna, who was an autistic girl, and we have some tape of Donna, I think, also, who noticed a huge improvement in her relationship to her environment, I suppose, after she had her glasses on. Let's have a look at that.
And I used to say, "I can't hear you, I can't hear you," but what I was saying was, "I can't understand you consistently. Your meaning's dropping in and out." Look at him. Before, I was just have seen his shape and colour and thought of him as a fluffy blob. Now I see a bird who comes to be in our company.